Good morning, good afternoon, and good evening, and welcome to the third webinar of the Open Global Health series focusing on media and global health. It is my pleasure today to introduce you to Siân Bowen. She's going to be the moderator of our event. Siân has over 20 years of experience working in the humanitarian sector in various communication management roles. She worked for different international organizations, from the International Federation of the Red Cross, Médecins Sans Frontières, the Norwegian Refugee Council, and the International Aid Society. She's currently responsible for communications at the Geneva Center for Humanitarian Studies. Welcome, Siân, and over to you.
Thank you very much, and it's a pleasure to be part of this webinar today. I would like to introduce our two speakers today. We have Julia Belluz, who is the Senior Health Correspondent at Vox and currently based in Vienna. She reports on medicine, science, and global public health across various platforms. Before joining Vox, Julia was a Knight Science Journalism Fellow at MIT. Her writing has appeared in various journals across the world, including BMJ, the Chicago Tribune, and The Economist. She's been awarded various different eminent awards, including the 2016 Bals Prize in Critical Thinking and the 2017 American Society of Nutrition Journalism Award. She holds an MSc from the London School of Economics. I'd also like to welcome Seye Abimbola. He is the editor-in-chief of BMJ Global Health. He is a health systems researcher and a global health scholar, and a senior lecturer in global health at the University of Sydney in Australia, where he's joining us from today. He studied community engagement in governance, decentralized governance, and the role of governance in adopting and the scale up of health systems innovations. So I welcome both of you today, and I look forward to our discussion. I want to start on a broader question to get things going on how editors and reporters contribute to shaping the global health agenda. And what I mean by this is what subjects are covered, what subjects are perhaps in the shadows that need to be brought out, and how in your roles can you help to throw a light on some of these things. I'll go over to Seye first.
Thank you very much, Siân, and it's good to meet you and Julia as well. It's a very big question, and I think the first thing to say in response is that as far as the global health literature is concerned, it's a very poor reflection of reality. I think it's the best place to start. And it's an often unacknowledged fact in global health academia that the literature only covers a very tiny slice of what goes on in the world, which also that means that there's a lot of things that people know that the literature hardly ever covers. And often those are either very local knowledge that apply very locally and are completely, absolutely consequential, or they are things that people are afraid to say or too careful to say. But you would hear people say them at sort of dinner tables, at conferences, or the corridors in their places of work. And for me, I think if a journal editor has some power, and there is some power that comes with the role, it is to shine some light on those things, sort of to privilege local knowledge to the extent that it's possible, but also to bring this controversial-ish, difficult to articulate-ish things to the center. And I think that there lies a lot of responsibility and a lot of power. And it's also important, I think, to mention that journal editors, in academia at least, have the power they hold is unaccountable in many instances. Sort of, I often ask myself, to whom am I accountable? Who watches me? Who holds me to account? And there's a sense of absoluteness to that power that for me also makes me feel much more responsible. You know, that like Spider-Man. So you have to then take it very seriously, this power that has been thrust upon you. And I think if there's one way to use it responsibly, is to shine a light on things that the literature has traditionally ignored, and to bring voices onto that platform that would otherwise not have a place on those platforms.
And could you give us one example that you've maybe come across in the last year that you were able to bring out of the shadows?
Well, there was a perhaps the most controversial paper that we've published within my circle. We've published other potentially controversial ones, but among people I know personally, there was an initiative that was continues to be heavily supported by the World Bank, and has a lot of fans. Lots of people like it, and if you know how global health initiatives work, once people like something, it becomes self-reinforcing logic to it. And there was growing a community of people who were concerned about that initiative, but their voices, they hardly ever got a central platform on which to air their voices. And they wrote a really damning, controversial 3,000-word criticism of this initiative, along with the people who support it.
What is the initiative? What is the initiative?
It's called performance-based financing.
Performance-based financing.
Yeah, it's an initiative that you use essentially performance-based financing to incentivize healthcare workers in mostly primary healthcare facilities, which in principle sounds like a good idea, but once you see how it plays out in practice, it's not quite as neat. And in spite of mixed results and mixed evaluations and concerns by people, the program just continued to grow and continues to grow. And sort of there's literature that sort of says you have to be very careful when you're doing this thing, and the literature seems to run parallel to the people who are financing it, right? So you don't just keep doing it. It's the single most implemented health policy intervention in Africa. That's how big it is. And so bringing that to a center stage and having people actually have a debate openly about it, I think changed a bit the conversation around it. And I think freed up people who would otherwise want to say something, but were perhaps too afraid or needed someone to go first before they could say something. So it opened that space. And I should say that I don't think it's a completely bad idea. It just has to be implemented in specific ways and in specific places. It is not something that would work generally, and I don't think it would work in most places. And it's just, again, that's the kind of logic that often you find in global health initiatives, that once something has worked in place A, then it becomes something that you want to take to B, C, D, E, F, right? And often the logic that makes it work in place A is very specific to place A. But because for some reason there's big money behind the initiative, or it's very simple and looks shiny and you can demonstrate some effect somehow, then just keep taking it to places, and people call it the traveling model, right? And again, having a place where often people who are on the ground, feeling how this plays out on the ground, or people who listen to people who are on the ground, actually having a platform to say what they think and to share what their experiences are is I think, an important thing that we don't often get in global health. That there seems to be some kind of barrier that stops those kind of ideas from making their way to the center.
Thank you, Seye. And Julia, I know that you have covered some quite controversial subjects, including the role of consultancies in international organizations. Based on your experience, what subjects do you think that you've brought out into the fore have had an impact on the way people think? And what subjects do you think are maybe, as I said, in the shadows that you would like to see more discussion around?
I think Seye raised many good points about this. It's the same thing we grapple with. Like there are so many stories to cover, and typically, like where I think media in general pays a lot of attention, it's like this 1%, this little like tip of the iceberg of the avalanche of, or actually that's probably mixing too many metaphors, but we're usually only focusing on like a very, very small fraction of what's actually going on. And it reminds me a little bit of what's happening now with COVID, like countries like Sweden or Germany, like there's like a few countries where we put a lot of attention and almost like ignore what's happening with the responses in the rest of the world. but I think, yeah, so I think that the management consultancy article was really interesting because it showed me or reminded me that global health is supposed to be this, it's global, it's supposed to be inclusive, and by its nature, it should, have many voices and different, maybe more diffuse centers of power than what the management consultancy article really reinforced for me was sort of Seattle, Geneva. There are a few key decision makers sitting in these places. People don't want to piss them off, basically, and don't want to talk about the things that are happening openly. And so, like, to give you a sense, like, for that piece, I talked to more than 100 people. It took, I think, more than a year to produce, and I was collaborating with a researcher who's amazing, Maureen Buissonnier, and she had already been working on the issue and had made some contacts, and it still took a very long time to get people on the record and get that story out. And so, yeah, and a lot of what I heard from people who had things to say but didn't want to go on the record was, if I say this, I really fear for my career. If I say this, I think I'm going to lose my job. If I say this, I won't get funded. And yeah, and then I think, like, on this question, there are many things to write about, but the burden of proof is really high. And so people talk about things at dinner tables or in the corridors at the office when we used to have offices. But then when you start, I think one thing I've run into a little bit when you start to probe or try to get the evidence that you need to muster to actually, like, write a credible article about it, it becomes a little bit more difficult. So it's not just, for two reasons. One is that I think, like, maybe sometimes, people sort of have a sense of something going on, but don't have the evidence that you'd need to bring it to light. And then for this other reason that I've just been mentioning, they know things, but maybe don't want to come out with it for fear of reprisal or job loss or their future in the field of global health. But now, obviously, there are these conversations about decolonizing global health and making it more inclusive. And it's something I think, in newsrooms and in editorial rooms in journals, like, we need to think about how to actually reflect those conversations in a more robust way.
And is there an area you're currently looking at that you're able to tell us about, a new angle?
I think one thing we're going to be, I don't know if I can talk about this yet, but basically, like, trying at a very high level, trying to tell the stories of countries that haven't been told as much as they should in the COVID responses, and not just countries that are in the north and predominantly white, basically. Like, but I think, like, COVID has revealed, if COVID has revealed one thing, it's revealed many things, but it's that the resources at baseline weren't a predictor of how a country did and how it responded and how creative and effective it's been in its response. And I think in the media, a lot of the attention, unfortunately, has focused on the usual suspects in the global north and these, like, more powerful economies, and we haven't maybe paid enough attention to what's happening in the rest of the world. And so we're working on something that will be reflecting that.
Yes, I think next year will be a very interesting time when there is time to reflect on the COVID response and when people start to realize what worked and what didn't work. And I think the media will have a responsibility to cover that. Seye, what are your thoughts?
Well, one of the things that I didn't anticipate, as I should have at the beginning of COVID-19, was how dramatically the number of submissions to the journal was going to increase. It increased at peak. We're getting about 27 manuscripts a day in May. So that's how bad it was. And it was before COVID, it was about 4 or 5 and 6. So it went back high, up really very quickly. And what struck me about those manuscripts was the sense that a lot of people were trying to make sense of what was of sort of a moving movie, of a moving thing, and it was hard to really make sense of that. And so very often those manuscripts were rejected. And one of the things that I also found very interesting was that a lot of the research papers that made it through to the journal had already had their impact in the world before it was submitted. Right? So that's one of the big things that COVID-19 also revealed, that in many instances, results of research are already making an impact in the world before they even make their way to journals. And again, for many of those, the results were just too temporary to make a lot of sense. And what we were trying to do was to encourage people to think about the future, which we felt were at least going to be manuscripts that could survive 6 months, 1 year after it was published. Because there was this sense that if you published the most current thing, it would lose value within weeks. So we focused a lot on those sort of future-facing papers. And what has been striking in those papers, as Julia was mentioning, that this been coalescing with decolonizing global health, right? So the more people see the response to COVID-19 and try to imagine a future in which we've learned from it, the more people imagine a more decentralized world, right? Decentralized in the sense that, the need, for example, for Vietnam to be as much a center of power as Switzerland is in global health, such that if Vietnam is getting something very right about COVID-19, but the world will also have the opportunity to get it right. I said the ways in which we see the world, one of the most striking things, the ways in which we see the world, I think is killing us, to put it very, very bluntly. Our inability to learn, an ability to get connected to knowledge from different parts of the world, in which we are not used to learning from, is killing us. And if there's something that our knowledge infrastructure should do going into the future and learning from COVID, it is to see itself as more a decentralized ecosystem and to nurture voices from all parts of the world. And that's a big ask, but I don't think we can escape the need for it.
I think that brings me to my next question, which is, what are the different pressures on publishing in something like BMJ Global Health and the pressures of publishing in a broader news outlet like Vox? And how do those pressures influence you in your decision making as to what you do and don't cover, in terms of, are you influenced by populism? Are you influenced by the powers above you? And how much freedom potentially do you have? So perhaps first, Julia, you could talk on the broader media cycle and how you get to choose what you cover.
Yeah. So in most newsrooms, it's reporters working with an editor, and an editor usually will be focused on a specific subject area. So I have an editor who's focused on science and health, and then she's answering to people above her. And our newsroom is pretty reporter driven. So the ideas, a lot of the ideas will come from the reporters. We'll talk to our editor about them, sort of refine and shape them, or questions we want to probe, and then go out and work on the stories. I think like all newsrooms right now are quite resource constrained. The COVID pandemic has hit the media really hard. And so, and media wasn't already in like the strongest position going into the pandemic. So that's definitely one big challenge. And another challenge is time. So the time horizons that I'm dealing with, I think, are quite different from the time horizons that Seye is dealing with. So usually, like we're thinking, although we have some projects that will be year long or even longer, most of what we're doing is responding to news. Usually, yeah, like it's either the same day or that week or the next week. So that the time horizons are moving pretty quickly. And I guess, yeah, one of the other big constraints working for a US organization, this was an election year, in case everyone forgot, because 2020, a lot of things have been happening. But this means like a lot of resources were diverted and energy in the newsroom to the election. And that means things very practically, like we have an amazing visuals team, and usually they'd be available for collaborations, and they can be involved in like a lot of the stories we're doing on science and health. But unless those were like intersecting with the election, it was sort of hard to get their time. And like we had a meeting yesterday on with the video team on like, you know, we need to get back to covering COVID on our video platforms, because they were completely consumed by election coverage. So I think, yeah, there are some really large newsrooms that have like staff who are kind of micro focused on even aspects of the COVID beat, like vaccines or policy responses or the US debacle or whatever it is. But in smaller newsrooms like ours, you know, like I'm one of the few people who's covering COVID, and yeah, so it's just like this question of how do you focus and where do you focus when there's so many demands on your attention.
And Seye, you're editor-in-chief of BMJ Global Health, which sounds like a very important role with a lot of power. What is the reality, and how, as you said earlier, some power comes with responsibility. So how do you go about choosing what you cover and balancing and making sure there's some diversity? Oh, you've gone on mute.
Yeah, I've unmuted. Now, for every academic journal, there's something called the impact factor, which is like a ghost, sort of in the view of an editor, and sort of always threatening. And one of the problems with the impact factor is that it makes you want to publish things that are more likely to be cited. And the truth of our knowledge is that citation is not the only marker of value or importance. And so one of the things that I have to deal with every day is to make sure that I ignore that ghost to the extent that it's possible. And I often succeed at doing that. And that means publishing things that may not get widely cited in the academic literature, but can alter and influence the conversation in the field, which I think is often far more important than those papers that will get you a lot of citation. The other pressure that I feel in making choices is to get a sense of not balance. Balance is not the word, but to be sure that what people are saying is true and reflects truth. And that applies in research as much as it applies in commentary. And you know, you have to read over and again and send to people who can critique it. And sometimes you send it to an adversarial reviewer, potentially, someone who might disagree with what's been written, just to be sure that someone is speaking all the holes. Because you also want to be a platform that people can trust. And trust is a very big currency in the work that we do. So that is also very important. And I think the third pressure that I have is to make sure that it is not a Western journal, right? That is not that, even though its name has British in it, that it is not a British journal. And that also comes with its pressures, because you want to make sure that when you receive a manuscript, for example, that it has local voices in it. That the study has been conducted in Kenya, that there are Kenyans on the paper, and that the Kenyans on the paper are not just there in a cosmetic way, but they're there in a substantive way. And again, these are difficult things to judge. And I often have email exchanges with authors just to be sure that they are representing who actually did contribute to the work on the authorship. Again, just to make sure that there's fairness and there's representation in what is being published. But ultimately for me, and I'm not sure if this is a pressure, but it's a realization that is always at the back of my mind, that a lot of what is published in a journal like BMJ Global Health is written for a certain vaguely defined global audience. Right? There is a sense that what we publish is for some global audience. And there's something extractive about that, fundamentally. that if you conduct a study in a place like Kenya or in Cape Town or in Delhi, that the primary audience of that should be the decision makers in Cape Town, Nairobi, or Delhi. And there's a way in which the existence and the overly centralized and powerful existence of the few academic journals, there's a way that it takes away from that audience. And it's a conflict in my head that I struggle to resolve, and I don't have a solution yet, but I think about it a lot.
Yeah, I think there is definitely a tension between the exclusivity in some ways of global health journals and versus the inclusivity we want in global health, and that we want global health to be driven by the people at the front line doing the work on the ground, and that the international world should be supporting this, and not the international world telling them what to do. So it's a bit of a paradox, isn't it, between exclusivity and inclusivity, and it's, I suppose, a tension that is quite difficult to work through. How do you said that you try and get local voices represented and not in a token way. How hard is that to achieve by both of you? Either of you want to answer?
I
know, do you want to go first, Julia?
Sure. Yeah. In particular with COVID, we've made a real effort in the newsroom to try to reach out to people in different countries and not just talk to the usual suspects, and just have more diversity in the sourcing that we use. And yeah, and I think like I see there's a question from Siri about this. So sometimes you see the same authors and sources popping up in stories and journals. What's behind that? I guess what's behind that is that I think there's something self-reinforcing about, you see a certain expert on, on CNN every night, and then they're writing op-eds in the American context in the New York Times and the Wall Street Journal, and people will just think of their names. And sometimes when you're starting to report on a story, you'll try to see, who is out there and who have other people talked to. And then that leads to this the snowball effect, I guess, where you see the same experts popping up again and again. But yeah, we've made a deliberate effort to diversify our sourcing in the newsroom, and also not just a lot of the emphasis, obviously, at Vox is on what is happening in the U.S. because there is this crisis right now, and trying to explain and unpack that. So even in the U.S. context, my colleagues who are covering that more closely are trying to make sure that it's not, just that it's women that they're calling women as well as men, and that it's people of color are represented in their sourcing. So yeah, it's something that we're thinking about now for sure, and trying to make sure that that we're not just speaking to the same people over and over again. And I think other newsrooms are making quite an effort to do this now. I know my colleague at The Atlantic, Ed Young, has sort of made this like a side project, really thinking deeply about diversifying his sourcing, and I know that there are other reporters who are doing this as well. And I think I think as much as we can criticize a lot of the coverage of the pandemic, I think there's been a lot of examples of excellence as well. Like I've seen some of very sophisticated conversation about epidemiology and public health responses, and even on places like Twitter, voices that I think we didn't hear from a lot before, virologists, epidemiologists, like making these amazing threads and in great detail about like parsing, what was the evidence behind the latest, or how, what questions do we need to ask about the Moderna or Pfizer BioNTech vaccines, and like parsing in real detail. And actually that's one way I think people have found new sources. These scientists and researchers who have become really adept at Twitter in the pandemic have sort of become quite, I think, like elevated in sourcing in more traditional media outlets as well. So sorry, that was a long rambling answer, but hopefully helpful.
Thank you. I'm just looking at some of the questions that are coming in on our Q&A, and one of it comes back to the impact and how do we make sure that what is being reported is evidence-based, and how does that have an impact? And Seye, could you perhaps give an example of where a paper has gone on to change public debate or have an impact in some way to move the direction of the global conversation?
Well, there was sometime, I think it was last year, a group of authors approached me to say that they wanted to publish. It wasn't just, it was 3 different groups of authors or people reached out to me, and they were all thinking about very similar things. So it was about the representation of low and middle income country authors on papers or on the editorial boards of journals, and we decided to publish everything that they pitched, basically. And these were four manuscripts, and I did an editorial to go with them. And it was primarily just to shift the conversation a bit. And it did shift the conversation in many ways. And I didn't, as an editor, I'm often not very optimistic about what the journal can achieve. So I allow myself to be surprised. But I wasn't expecting the amount of response and the ways in which different journals, different organizations made decisions partly based on those series of papers to say, we are going to diversify our editorial board, we're going to have a rule about authorship, that we, paper from that particular country has authors from that country. And it spun different conversations that's gone to different directions. But it did change something, and I didn't see that coming. And the decision was not made based on impact factor or anything else, but recognizing that there's a certain tension in the field, and people wanted to say something that's quite difficult to say, and we decided to give it a platform.
Thank you. And Julia, we have an interesting question about how do we deal with conspiracy theories and making sure that what is covered is fact checked, is as accurate as possible, and how do we counter conspiracy theories in what you publish?
Yeah, we have a lot of debates about how much to draw attention to certain things. You know, like I think there's like a threshold, or there's a point at which you can't ignore something, and you need to find a way to cover it that isn't going to give any credence to whatever the conspiracy theory was. And it's something obviously we grappled a lot as an American organization with President Trump in the White House, who was often, the source of, I think there was a research paper out that he was the single biggest source of coronavirus misinformation. And so, it's something that we grapple with a lot. And so first there's the question of like, do you cover this? Like, does it warrant amplifying? And in some cases we decide that that actually this hasn't bubbled up to the level of it that it is worthy of more attention. And then we try to approach the issue in a way that isn't that makes it very clear, like, you know, there's this idea of, is it called like sandwiching, like where you try to kind of write the debunking in a way that isn't that doesn't amplify it in people's minds or give it credence. And usually like that, so this means like going to people who are authoritative voices and work on the issue that you're writing about. And then it also means like going back to in cases of health and science, like primary literature, and making sure, yeah, you're actually using evidence to substantiate whatever you're looking at, or whatever the issue is. But I'm having a hard time thinking of examples of where we've done this recently. There's so many, and I can't think of one right now, but yeah, it's something that we think about a lot and we've had to deal with a lot, for sure.
Thank you. Now we have a very interesting question about decolonialization of global health, and are the efforts to do this tokenistic? We have a listener who's saying that every conference now needs to have a panel on decolonization. The BMJ needs to have a space dedicated to discussing this, and how can we change practices and structures rather than it just being a tick in the box exercise. So Seye, as BMJ's specifically mentioned, how are you dealing with this issue?
So I think that the risk for every movement is to get token concessions from the people from whom they are making demands, or to get very cosmetic, unreal, fake change from whom they are making demands. And I've always been very afraid, personally, that the movement to decolonize global health and the conversations around it will likely end up with tokenistic kind of change. And for me, at where I am now, I'm trying to encourage more and more people to talk about very concrete things that they want to see changed. Like what does decolonization mean in very specific, concrete terms? And my sense is that we are getting to a stage where it's no longer new to say we need to decolonize. We are getting to a stage where what does it mean for the graduate institutes in Geneva to decolonize global health? What does it mean for the London School of Hygiene and Tropical Medicine to decolonize global health? What does it mean for the Lancet or the BMJ to decolonize global health? What kinds of concrete change do these organizations need to make? And I think that is the next stage of discussion. And if there's one thing that I wish was on the table in that discussion, it is the ways in which these organizations want to decentralize themselves. They want to essentially take away power from themselves. And if we are not making those very clear and specific demands of those who hold power in global health, we're just talking around this problem. And it's very easy to talk around problems. And if there's any lesson from history, it is that movements often fail when they are not specific in their demands. And it's very easy for organizations to come out and say, well, we are decolonizing, we now have set up a committee, we have this, blah, blah, blah. But it has to be very specific, and the demands of them have to be specific. And I think that's the direction in which the conversation needs to go. Otherwise, we're just fooling ourselves.
Yes, I think what you're saying is there has to be structural change and a decentralization of the sort of publishing system in global health for it to truly take on this challenge.
And beyond the publishing system, it's also the governance system, right? And the educational system. So the teaching institutes, the Global Fund, the World Bank, etc. In what ways are they going to stop being powerful, essentially? How are they going to divest themselves of power? And that, for me, is the central question.
Julia, would you like to come in on that?
I think in terms of like the way I think the analogy in our newsroom is thinking about representation and the reporters and editors that are hired. And I don't know what the latest numbers are, but there's been a massive effort to make sure that the newsroom is diverse and actually better reflecting the audience. And yeah, I don't know. I don't have the latest figures, but that's something that they've made a lot of progress on at Vox, and the newsroom looks like a much more diverse place than when I started there 5 years ago. And I think it makes a big difference in the types of stories that are covered. Obviously, like you have people from different backgrounds and different cultural settings, and they're bringing ideas that weren't maybe brought if you just had white people from Boston and New York reporting and editing in the newsroom. So yeah, that's something that and even from an images perspective, the photo editor at Vox, Kainas Maria, has been working really hard to make sure the images that we put on our stories are also much more diverse and yeah, and I think yeah, so there's I think people thinking about this from a slightly different angle than I guess decolonizing global health, but it's something we're definitely trying to do in the newsroom.
Okay, thank you. We have a question going back to COVID. Do we think the media has got the balance right between drawing attention to the wider collateral damage to health and the country's economies versus the biomedical aspects of COVID-19? So are we getting the balance right in the stories that are being told? Perhaps, Seye, you could respond first to that.
Yeah, so to the extent that the journal is concerned, I try very hard to stay away from the debate on whether we're doing too much or too little on COVID. That is the commentaries. I want to see the facts. So it's one area in which I'm very insistent on people bringing numbers. And there are lots of numbers around the lockdown in Africa generally, which in many places has not worked quite as well and was quickly reversed just for practical day-to-day life reasons. But I try to stick to the facts on this because it's not a question that you can answer in a simple way. Because again, the answer will be different from place to place. There are parts of the continent where lockdown was absolutely necessary and was absolutely consequential in reducing the burden. There are places where it was just a disaster for way too many people and should never have been done. So there are those kinds of issues that for me, I just want to stick with the facts. Just give me the numbers and leave it there. And let whoever is reading make up their mind. Because it's a tricky issue. Yeah. I see.
And I think like a lot of the collateral damage we don't have like now we're starting to have a sense of the scale and concrete evidence with what's going on, but I think it's just harder to see. I think the economic story definitely gets I think quite a bit of coverage. The job losses, the effects on the economy. I think the collateral damage gets less coverage than it should. But I think the reason is that it's something that we haven't even begun to quantify or understand yet. And yes, but you see coverage of things like reductions of cancer screenings or children not being in school and the effects that that's having. And but I think the scale of it, we're only going to begin to understand like next year and 5 years from now how much of an impact this really had. Yeah, I think in other ways, like the evidence, and now I guess just about a year into this, like we do have much stronger evidence. Like this week, I'll have a story coming out looking at, we now understand very clearly that like one of the biggest determinants of who gets this disease is crowding in housing, like the square footage in the house that you live in. And obviously that's overlaid with things like race and the job that you do, but crowding is like a massive driver of this. And I think that's something that we haven't talked a lot about, like the social, or at least in the media discussions, the social determinants of both who gets the disease and then their outcomes and how do you tailor policies to actually reflect that. I think in a lot of media stories, it's still like lockdown or not, this like very binary and not very nuanced way of thinking about it when that's not really where the evidence is now.
Okay, we have a question here about conflict of interest. So when you're doing your research, your fact checking, interviewing, etc. How do you make sure you're looking out for conflicts of interest, whether it be in the people that you're talking to or conflicts of interest that you come across yourself? And how do you deal with that when you're dealing with a global health story? So perhaps Seye, first of all.
Yeah, it's difficult and it's tricky, and there's a lot of, again, discussion around conflicts of interest, and the one that's top of mind is the one around a funder funds a project, the same funder commissions an evaluation of it, the same funder co-authors the evaluation, the same funder pays for the open access charges to get it published. So you have this sort of very incestuous kind of environment where the power is so concentrated. And then you receive that kind of manuscript and you wonder what kinds of conversations are going on behind the scenes that you've not had that privy to. And thankfully, there are a couple of instances like that that have sort of made the global health academia headlines of influencing academics to tell positive stories of things that are not quite as positive, because the funder is involved in all these steps along the way, and also involved parties in also funding the researchers institution itself, for example. Mm-hmm. So you have this absolutely power concentrated environment where it's hard to make decisions. And as a journal editor, it's hard. You can only read in between the lines to the extent that you can read in between the lines. And often it's a question of trust. You just choose to trust. But there are issues like that. But on the flip side of that, it's also for me the consideration of the kinds of work that requires someone who is deeply embedded in the narrative to tell the story. So a minister of health sets up an initiative, or bureaucrats in the Ministry of Health are implementing something, and you want to hear from them. And again, how do you make the judgment of what is apparently a conflict of interest involved in that you want to tell a good story about what you've done. You don't want to show us where it is not looking so good. But at the same time, we want to hear from you because you are the person best positioned to tell that story. So again, you read very carefully, you essentially encourage, and for us, I insist, for example, there's a segment on lessons learned in that kind of paper, just to force whoever is writing to tell us what they may not otherwise want to tell us. So it's difficult as journalists. So you can only trust as much as what's presented to you and hope that people are being true. But yeah, there are those issues.
And Julia, in the article you wrote about consultancy work within international organizations, I saw within that there was many perceived conflicts of interest in terms of funding and evaluation and publishing, etc. So is this something which you particularly came across in that article and looking at that area, or do you come across conflict of interest quite frequently?
Oh, everywhere, for sure. Like I've covered obesity, diabetes, nutrition a lot. That's a hugely, massively conflicted area. In particular, the literature, like a lot of the studies come from the food industry. And that shapes the questions that are being asked and what ends up being published. Now, like in the COVID-19 vaccine race, like obviously we're not just going to talk to the companies about the emerging evidence on the vaccine's effectiveness. We're trying to seek out people who are expert in clinical trials and study design, and who have like a really deep understanding about how to even evaluate what we know at this stage, who are independent of the trials. So yeah, it's something that seeps into like every area of coverage for sure, and something you always have to be on guard about and think about. But yeah, as Seye said, you can't fully protect yourself. Like in some sense, you also have to, rely on sources that you trust over time, who who have proven to be trustworthy, and seek them out and their opinions. And but yeah, it's a minefield for sure in health, and there's just so much money and vested interest in it that it can be very tricky to navigate.
Thank you. And Seye, we have a question here about whether in your role, particularly as an editor-in-chief, you have experienced pressure to veto or discourage a story because it could affect the powers that you report into, or more widely, or that it's deemed that that subject is too sensitive for discussion at the moment. Do you have any concrete example of when you've come under that kind of pressure?
No, it's never happened. I have a lot of editorial freedom, so I make the final call on everything. There's only been one instance in which we've had to not publish a paper for legal reasons, and it was because, I'll describe it vaguely, it was because there had been a long-running trial on poor people in a particular country. And the trial had not been conducted, the authors alleged, ethically, because they had told their funders that they were going to compare their intervention with the best alternative. And the best alternative was a particular concrete intervention. But when they went into these little villages with poor women, the alternative that they offered was nothing, which was against what they had told their funder. And it so happens that their funder has freedom of information rules. So the authors were able to obtain the documents that they gave to the funders to show that they had done the wrong thing and the unethical thing. Now, we would have published that, but the BMJ is a British journal and doesn't enjoy the First Amendment rights that an American journal would enjoy. And the burden then would have been on the journal to prove that it should have published it, which would have been very costly and would have been a long, drawn-out legal battle. So we didn't publish it. But apart from that single instance, there has not been any instance in which I've not been able to publish what I felt we should publish.
And Julia?
We've never had anything killed either. Our story, like someone asking, or an editor or something asking not to look into something. But when stories are particularly sensitive, like the management consultant story, we work very closely with the lawyers at Vox to make sure that we don't end up, in some kind of legal squabble or, and so basically, you have to, again, like the burden of proof is just quite high. You have to make sure that every claim is substantiated, that the way you're phrasing sentences isn't going beyond what no one can prove if it came to it in court. So we do think about things in those terms when stories are particularly sensitive.
Mm-hmm. So we have a couple more questions coming in on COVID. One is, have you seen good examples of countries being held where the media is holding the government to account on what its response is? In the absence or reduction of formal structures to do this, how has the media helped to hold different countries to account to date?
I think in the American context, I'm really, so I think I said this before we started officially, but I'm sitting in Austria, where we now have the highest per capita number of cases per day being reported in the world. And you almost don't know it reading. I don't think I've seen this reported in an Austrian paper. I've seen researchers in Austria tweeting about it and things like that, but you almost don't know that we're in like, now cases have started to decline again, but we entered like a period of basically like of crisis, and the hospitals are starting to fill up and the ICU beds are starting to fill up, and you really wouldn't know it. And contrasting that with the attention that I think American media has paid to the US response, and in particular holding the Trump administration accountable for essentially letting people get really sick and die, it's quite a stark contrast. And I think that the US media has done a really good job of documenting all the ways in which yeah, America went into this crisis in a really strong position with resources and expertise, and completely, yeah, failed in its response. So yeah, I think that's a good example and a bad example.
Okay, we're starting to get nearer the end of our webinar, so we're going to try and squeeze in a couple more questions. We have one here, which is there room to write critical stories about global health darlings and their leaders, for example, Rwanda, Ethiopia, and on global health philanthropists? Seye, are you able to write critical stories on key decision makers and leaders?
We are able to if people submit them. So this is one of the cases in which people are, I think, afraid to write critical stories about global health darlings, Rwanda, Ethiopia, and big funders like the Gates Foundation. Even when people write about them, they write in such tempered tones that you can almost not see what they are saying unless you really know what they are trying to say. So it's an issue of people being bold enough to write about them, and there are instances in which people who have tried to write about some countries, which I shall not name here, have been threatened and their lives been threatened because they are from countries that are run essentially as dictatorships. So there is also that dimension to academic global health, that there are countries' health systems that people are afraid to criticize, including people from those countries, especially people from those countries. Because if you live there, then your life is a bit more beholden. You're more beholden to the government. So there are those things, and we see them as sort of a journalist. So you get to have a view, or you get to see what happens in the background, and I think that make it because authors are afraid. Authors pull their name off a manuscript. Authors pull the entire manuscript because someone has threatened them. And there have been cases like that. So yes, the big question is: are authors going to be able to write about them? Really?
Yeah. And Julia, we have a question here about the funding of the media business model. Who funds it? Do you think there'll be a change in the way the media sector is funded to allow there to be more broader and more broader coverage, or will the media sector always be influenced by mega funders?
I think, yeah, we're actually, I think, entering a moment where the media, at least I'm speaking again from the US perspective, I think we're entering a moment of increasing fragmentation. And so there's a platform called Substack. It's like a newsletter platform that allows journalists to sort of go independent and yeah, send out newsletters to audiences, and it's become like increasingly popular. We've had people leave our newsroom and other major media outlets in the US to become independent and yeah, basically write for audiences that they create, and that really scares me because yeah, like you think in the US context already we don't have something like a BBC or like this kind of national more cohesive voice. It's already quite fragmented, and when you think about like this increased fragmentation of journalists, like kind of developing these mini fiefdoms and people seeking out the voices that they want to hear from and the issues that they want to hear about only, that kind of scares me, and I think that seems to be the trajectory that we're headed on. And yeah, just seeing how not only in the US but this this political tendency toward populism and yeah, where we're heading politically globally, it scares me. So yeah. I think that yeah, sorry, I think we have 1 minute left.
Okay, yes. Well, I'd like to thank you both for your time today. And it's been a fascinating discussion. We could go on for many more moments and discuss many more things, but I'm going to hand back to Elisa now. But thank you very much, guys.
Thank you, Julia, Seye, and Siân for this great discussion. And thank you all also for joining our webinar today. I invite you to participate in our upcoming events at the end of November and in December. You will be able to find more information on all our events on the Global Health Center's website. And one last thing, please don't forget to complete the survey that will open at the end of this webinar. Thank you, and I wish you all a nice rest of the day.
Thank you.
Thank you.
Thank you very much.